Rorschach's approach, known as the projective method. In recent years, a great many test devices built on this principle have been developed. Most psychologists use a series of them to obtain a clearer understanding of the subject. Such a series is called a test battery. You are going to see how some of these tests are given and hear a brief explanation of their meaning. The principle of the projective test is roughly this. The subject is allowed to do as he pleases in a relatively unstructured test situation. What he does is then likely to be shaped by his reaction patterns at a deep level of personality organization. All projective tests offer much information about basic psychological processes to the examiner who has eyes to see it. Probably the Rorschach yields the best overall picture of the personality. Certainly it is the test most widely used at present and can boast of the largest number of examiners with eyes trained to see. Still, the psychologist wants a battery of tests. Partly, this is for purposes of corroboration. The examiner feels more secure when he can see the same processes at work in a number of different test situations. But partly, each test has a somewhat special orientation, highlighting somewhat different of personality functions. The battery fuller, more rounded picture of the subject.
The subject will soon be coming in for the demonstration of the tests. The first one to be shown, sketchily of course, is the Thematic apperception test, developed by Murray at Harvard. This test is widely used to bring out conflicts, aspirations, fears, and attitudes, personal and interpersonal. It consists of 20 pictures, somewhat vague or ambiguous, about which the subject is asked to tell a story. Murray suggests giving the entire series in 2 sessions. When time is limited, the examiner may select only a few pictures, especially likely to bring out the themes which seem most important in a particular case. The examiner's job is to see that the story is fully developed according to the instructions.
I'm going to show you some clues to make up a story about one. Tell me what went on before, what's happening now, what the characters are feeling and thinking, and what the final outcome is. You understand?
I don't know.
There you are. Here's the first one.
Could I just tell a story?
Yes, whatever comes into your mind.
Well, this is a story of a boy prodigy. He comes from musical parents, or he came from musical parents, and they wanted him to be a musician. He finally chose the violin. Now, he should have gone on from renown to fame, like Yehudi Menuhin, but even at this early age, this boy developed a kind of a strange resistance. Even though he had enormous talent, he deeply resented having to perform in front of other people. At this particular moment, he's very, very deeply concerned because he has to play that night with the Cleveland Symphony. Well, upstart of it is that he fell sick and never did give that performance.
The subject has not told the final outcome of his story.
At all?
Well, what finally happened to the boy?
Well, the boy never did play the violin again, and later on he regretted this in his life because he was, in a sense, frustrated.
Mm-hmm. That was very good. Yeah. Here's another one.
Well, this is a story of a rich boy who's been sent by his parents to have a faith healer cure him. Well, he apparently had a paralyzed leg for which the doctors could find no somatic cause. This moment we see the faith healer treating the boy and the boy trying to respond. I think there's irony in this picture because the boy is, later on when he was asked what the doctor did for him, what the faith healer did for him, the boy said, not a damn thing.
Here, the attitude of the subject is not clear.
What did you have in mind when you said there was irony?
Well, I mean that the boy likes being sick at this moment, and nobody is going to get him well if he can possibly help it. No trick is going to get him well.
Okay. There's another one.
Oh. Well, this is the story of a girl at a boarding school. She's a kleptomaniac. She stole things from the other students and hid those things in her room, clothing and things. When this was found out by the school, the students made fun of her and the faculty expelled her. She couldn't figure out why she had to steal things. When she left later in life, she went to a psychiatrist, and from the treatment, she was able to learn why she had need to take things from other people.
The examiner does not know how the subject is related to the scene in the picture.
But what is happening in the moment in the picture?
Oh, I see. Well, this is the moment of her very deep despair after she's been expelled. That's a pistol there beside her, see?
Mm-hmm.
And she has tried to commit suicide, but found she didn't have the courage to go through with it.
I see. You're quite a storyteller. Very well. Now I have another test for you. And this includes a group of sentences, and I'm going to read the first phrase, and I'd like you to go on and complete the sentence for me. You ready?
Yes, sir.
Children are usually certain that...
You want me to complete this?
Yes, whatever comes into your
Children
mind.
are usually certain that their parents are infallible.
People are praised when...
Praised when they have worldly success.
A person is most helpless when...
Well, most helpless when his mind is confused.
The hardest decisions...
Are those which concern the destiny of other people.
There, I think you have the idea now. Will you do the rest of these? Writing them, there are 75 in all.
Write them out.
Yes, please. The subject is now working on a form of the sentence completion test as adapted by Miali and Holsopple from a method originally suggested by Tenba. Studying the pattern of the subject's replies often yields much information about his more overt personal problems and social feelings. Several forms of sentence completion test are in use, highlighting various types of personal and social or vocational situations. Sometimes simple but rather ambiguous situations are told in pictures, and the subject is asked to indicate the most likely outcome, write an appropriate dialogue, or in some fashion elaborate the problem in his own way. These tests are relatively quick and can be administered to a group of subjects simultaneously. They may be of special value for problems of school adjustment and vocational guidance, where overt behavior is of primary importance.
Well, I guess that does it.
Thank you. Now we're going to do a word association test. I'm going to read a word to you, and I'd like you to answer with the first word that comes into your mind. And I'd like you to be as quick as possible because I'm going to be timing it.
Yeah,
Understand?
I know that when we took it in the Army.
Okay, then I guess you know it. The first word is world,
Mine,
love,
good,
father,
mother,
The word association techniques are of special value because they offer indications of the major conflict areas and also often give some information about thought processes. The technique shown here is the one adapted by Rappaport to diagnostic testing. There are 60 words, some neutral, some likely to provoke an emotional reaction. The time of response to each one is recorded. The examiner then asks for an explanation of responses which came slowly or were in any way unusual.
Boyfriend?
Girlfriend?
Social?
Business.
Hospital?
Sick.
Doctor?
Lawyer.
All right. Now I'm going to ask you how you came to think of some of your answers. What did you have in mind when you said mine to the word world?
The world is mine. That's a poem, I know.
When I said social, you paused quite a bit before you said business. What was in your mind?
I just couldn't think of anything.
Well, what is the connection between social and business?
Well, I think that, to me, social has a bad implication. It means a waste of time, and I prefer to spend my hours on more useful things like business.
All right. Now I'm going to ask you to make a picture of a person.
What do you mean, make a picture?
Well, draw a picture of a person, and I don't expect you to be a marvelous
I can't
artist.
draw.
Oh, do the best you can.
What, a person?
Yeah, do the whole thing.
The subject has chosen to draw a man first. When he finishes, the examiner will ask him to draw a woman, and perhaps an animal or a child if there is time. While he is working, we will show you the drawings other subjects have made, so that you can see how different they all are, and perhaps why things like size, position on the page, line and pressure, handling of proportions, clothing, and so forth, mean something beyond just drawing ability. Tests involving physical action in space, rather than verbal performance, seem to express patterns of motor control directly. Such patterns are fundamental even for the normal person, and may be of crucial importance in the diagnosis of organic brain pathology. The test concept may be extended to include such expressive products as handwriting and the more complicated art forms of painting, sculpture, dancing, and above all, dramatic representation, also play techniques. Such media are extensively used in therapy nowadays, especially for children. Usually, consideration of the motor expression is combined with interpretation of content. The test given our subject is one adapted by Mackover from the Good Enough test. You have also seen a specimen of the HTP test, where the subject is asked to draw a house, a tree, and a person. Here is the man our subject drew. Asking questions about the drawings clarifies their meaning and often adds new material. Many subjects, especially children, talk about their drawings more freely than about themselves, frequently in transparent disguise. Mackover supplies an extensive list of useful questions. Some examiners ask the subject to write freely a description of the people drawn, thus obtaining a spontaneous handwriting specimen as well for independent analysis.
Yeah. Is it there?
Oh. Well, you're really a talented artist.
Well, you say that.
What kind of person is he? Tell me about the man.
Well, him?
Mm-hmm.
Well, I think he's pretty euphoric. I think he, faces life by kind of a Chaplin-esque attitude, a little state of false happiness.
Well, what does he do? What does he do for a living?
He sells peanuts and popcorn and balloons in Central Park. I don't know what he does.
Okay, you're bad. But tell me, what are the best points about him?
Well, I think he's kind to dumb animals, his wife, and he doesn't demand or take a greedy share of life.
All right. What are his worst points?
He's vacillating. He's unsure of himself. He's afraid of most people and probably of himself.
The subject has done a bit of spoofing, but significant attitudes emerge nevertheless.
Now we have another test for you. I want you to look at these pictures and point to the one that you like the most.
I don't like any of them.
Oh, go ahead. Pick one that you like the best.
Well, if I have to.
Mm-hmm.
There.
All right, and the one that you like next best? Now, the one that you dislike the most.
This test was developed by the Hungarian doctor Szandi. It consists of a series of 6 sets of pictures. Each set contains the photographs of 8 psychiatric patients, each falling within a different diagnostic category, such as paranoid schizophrenia, depression. The procedure shown here should be repeated 6 times. The administration of this test is simple, but its interpretation is extremely complicated and should be undertaken only after extensive training in the Szandi test, as well as the general psychological training necessary for the use of any projective method. The graph shows how the pattern of likes and dislikes is prepared for interpretation. The rationale of the test is controversial, but it appears to reveal the pattern of deeply unconscious needs and striving.
Is that all?
I guess that does it.
All right, thanks.
Well, thank you very much. Goodbye.
Goodbye.
You've seen only a few of the many projective techniques now used by psychologists. One whole area has been omitted because administration of the tests was too complicated for camera presentation. These are tests offering a refined analysis of thought processes. Among these, the Wechsler-Bellevue Intelligence Scale is the most widely used. Tests of concept formation, like the Vygotsky and other tests involving the sorting or classification of materials, are especially important where organic brain damage is suspected. Occasion of guidance. Here are a few questions for you to consider. 1. Why should letting the subject do as he pleases in a limited test situation reveal so much about his general personality attitudes? 2. Why is a battery of tests desirable? And 3. Why is thorough psychological training and wide experience with the tests especially necessary for psychologists using the projective method?